Hello, Dr. Rotchford here, once again with topics in opiate addiction. Hello. So today I think I'll venture into an important area and one that's poorly appreciated oftentimes in helping people with opioid use disorders. And that's the notion of comorbid conditions. Comorbid is simply a fancy way the doctors talk about things that go together or oftentimes associate one with another condition. Because opiate use disorders involved brains that aren't working right, it makes sense that other areas of the brain are not often working right. Why is that? Well, because the brain's integrated. It's all one unit. You affect one part, it affects the other. Granted, there are specific areas that have specific functions. But the more you appreciate that the brain is integrated, interconnected, works through loops and feedbacks, and everything is intertwined, the better off you'll be at understanding interventions, effective interventions, which help improve brain function. So that's going to be my point for today. Let's have an integrated, comprehensive approach. It just turns out that often, in my experience, people with opioid use disorders have identifiable other comorbid conditions, often medical, often psychiatric. Psychiatric ones include bipolar disorder, attention deficit disorder, PTSD, personality disorders, anything. Because anything which creates anxiety. If the brain's not working right, you're more likely to be anxious. I mean, when it's really not working right, when you're crazy, you can even get paranoid, like everything's a threat. So clearly, when brains aren't working right, people tend to be anxious. Hence, they're more likely to be attracted or to utilize opioids. Why? Because opioids are very effective at reducing anxiety. So it all makes sense. Once you get it, then you know that the idea is how can we help the individual have less anxiety? How can we help the patient's brain function better? If it functions better, if it's got good sleep, it's got adequate nutrition, adequate stimuli, it's not under constant threat for whatever reason, hey, you're going to see improved function. I'll guarantee you. So that's the first thing, is eliminate factors that could be interfering with the brain working well. And that's why oftentimes I'll recommend within the 6 months of diagnosing someone with an opioid use disorder to actually have a formal psychiatric evaluation, looking for all possible comorbid conditions. Sometimes those things don't turn up right away and you can only see them as being evident over time, but I still think it's a reasonable thing to consider, a good thorough evaluation. Medical problems can create anxiety as well, whether it's thyroid problems, anemia. Listen, I'm a pain management specialist. That's a big one. I mean, it creates anxiety and all kinds of problems. And in fact, people get confused. They say, well, is it pain or is it my addiction or what is it? I say, neither. It's your brain. We got to help your brain work better. Brains that work better manage pain better. I'll say that again. Brains and central nervous system functioning well manage pain quite well. That is, you can have serious osteoarthritis in your knee or elsewhere, or chronic conditions, and have no pain because the brain's doing its job. It's inhibiting. It's saying, don't pay attention. It's not important. That's a brain doing its job. Now, as we get older and other factors, genetic and otherwise, can interfere with proper functioning, you get this condition called chronic pain. And it is a chronic pain. No, and we can actually define it. We see it, the brain's not working right, there's inflammation. And that overlap between chronic painful conditions and what we see in brains that are suffering from opioid use disorders, it's no coincidence the overlap is big. Yeah, and we can see sleep problems, we can see other comorbid conditions, we can see dysfunction, fatigue, poor focusing, distractibility. Well, because it involves all the same areas of the brain for the large part. I mean, sure, there's specific pathways and areas related to pain or nociception. And there's specific pathways to learning and, if you like, addiction. But the overlap is huge. And in fact, pain itself creates a dopamine surge. So that means that, as I've said before, pain has the potential even to be kind of addictive. And I know that sounds weird, but the point I'm trying to make today is start thinking in integrated ways. It's not either or, it's a both and. So it's not, do I have a pain problem, or do I have an addiction problem, or do I have this problem? Just, how can I get my brain working better? What might help? Help me, doc. Try to figure out ways to get my brain working better. Now, it's complex. And I suggest you get good input, professional input, regarding those things you might do or could be done to help the brain central nervous system working better. That being said, if we feel safe, brains generally function better. So if you can start sleeping well, adequate nutrition, support structure, exercise, deal with the stressors effectively in your life, guess what? You're likely to see improved brain function. Why do we feed kids? To make sure they do well in school. Well, the brain's hungry, doesn't have enough sugar, it's not going to do its job. If you got structure and support, children are, comfortable, feeling safe, having fun, hey, they learn better. Why? Because their brain's working better. Makes sense, I hope. So here's the take home again. A lot of things can affect brain function. Let's look into those things that are common in people with opioid use disorder and address them. Rather than just say it's either this or that, it's their drug problem or it's this problem. Hey, it's a brain problem. Let's do all we can to help brains work better. That's my suggestion. And when you approach it that way, the news is good. Thank you for your attention.